One.
Hi Julia, I'm Rachel. Your physical and occupational therapy team and I have created this video for you in order to prepare you for your future physical and occupational therapy sessions. As you already know, multiple sclerosis is a disease in which a person's myelin sheaths are damaged because your immune system is attacking them. Damage to the myelin sheaths disrupts communication between your brain and the rest of your body. Ultimately, the nerves themselves may deteriorate, which is a process that is currently not reversible. I understand that you've been having multiple intermittent flare-ups, which have caused balance problems, poor coordination, occasional tremors, fatigue, and damage to your nerve cells. We will need to work with you specifically after your flare-ups, and then we gradually move into self-care. Your case is unique because MS attacks are sudden and they last different amounts of times, like multiple days, weeks, or even months. You should be prepared for the pain you feel during the flare-ups to get worse over time. Medications may be prescribed to you to reduce your symptoms. Home therapy options might become the best course of action for you depending on how your treatment goes. The overall goal of this treatment plan is to reduce these symptoms. There are many professionals that can help you during your rehabilitation process. A speech therapist would help you control your speech by conducting different speech exercises. The speech therapist would also help you work on swallowing if the muscles around your mouth are damaged, which would also affect your speech. A counselor may be needed to help you if you were to develop depression or anxiety during the course of treatment. A counselor would also be able to help you work through your feelings, and they would offer a positive way for you to deal with your emotions. A nutritionist may be utilized to give you information on the role of diet in managing MS symptoms, and they would be able to guide you on how to make a plan to eat healthy, enjoyable meals. A nutritionist may recommend a balanced, high-fiber, low-fat diet to promote wellness, reduce fatigue and constipation, and to help manage weight issues. Right now, you'll be working with a physical therapist and an occupational therapist. Your physical therapist is Anna, who will now explain to you what the physical therapy is.
The goal of physical therapy will be to promote safety and achieve and maintain optimal function by strengthening your muscles and mobility. A typical session will last about 30 minutes. To begin the session, you will update me on any flare-ups you have recently had. Also, during the first session, I will test the strength of all your muscles, range of motion, and the quality of your muscle contraction. Any weaknesses will be noted and we will work from there. I will also test your reflexes and your nerves and see how they are communicating with each other.
The sessions will involve simple exercises and stretches to strengthen areas of the body that have been affected by nerve damage. To work on your balance problems, you'll do aerobic training. For example, I will have you run on a treadmill. Also, I will have you do some squats and some isometric exercises to maintain strong muscles in your arms and legs. The isometric exercises will help your biceps and triceps. The squats will help to strengthen your quadriceps, hamstrings, and gluteus muscles. Since you are a computer programmer, we'll be sure to have you perform exercises that use your hands. An example of an exercise for your hands is named with this. Although this may seem very simple, this exercise can increase your range of motion, strengthen your hands and fingers, and give pain relief. This will work the flexor digitorum muscle. As an example, if in the first session we found that your hip flexors and quadriceps were weak, we would work specifically with those muscles, as they are very important for standing and walking. In order to strengthen these muscles, I would have you lie on your back and do some leg raises. Also, to work with those specific muscles, I would have you sit on the edge of the bed and kick your legs as close to parallel as your muscles will permit. Over time, these simple exercises, done both at home and at our sessions, would strengthen these muscles.
Since MS can have unpredictable setbacks, we will set up the rehab in 5 phases. First phase will be walking with a walker. Second phase would be progressing to a wheeled walker. Third, we would go to a quad cane, and if you can work with that, Then we go to the next phase, which is just a plain cane. Then the 5th phase would be walking without a device. And this would be one of your goals, to be walking without an assistive device.
The goal of occupational therapy is to enhance independence, productivity, and safety in all activities related to personal care, leisure activities, and employment. During your first session, we assessed the level of your skills in 3 different areas. The 3 areas were self-care activities, which included your functional mobility, dressing, bathing, grooming, and eating abilities, your productive activities, which included paid work, home management, caregiving, and volunteer activities, and your participation in leisure activities, which included your social and recreational events. In order to help you build fine motor skills, we will also be doing coin stacking activities along with learning how to write and various other occupational therapy exercises.